My dear students, welcome to Chips and Game for Rats. In today's class, I shall be dealing with renal and bladder tumors. Always, as undergraduate students, we should be very clear with the questions. Only then we will be able to arrive at the answer. Following this advice, I have narrowed down a description to three conditions, namely the renal cell carcinoma, the Wilms tumor, and the carcinoma bladder. Let us visit them one by one. First, we shall be seeing the renal cell carcinoma. Look at these pictures. I'll go to one first. So this is a beautiful resected specimen of the kidney. I am saying resected because it has been removed. And for your exams, you people can say it is a mounted specimen of the kidney. I say kidney because I am able to see the renal pyramids over here. So there is a cortex outside and a medulla inside. So corticomedullary differentiation. All these regions are normal. So this is probably the calyces which are uniting to form the pelvis. At one part of the upper pole, I am finding a tumor. The tumor is large, almost well circumscribed, but then it is having a varied appearance. It is appearing yellowish in some areas, red in some areas, and somewhat mucoid in some areas, also friable if I were to touch it. So this kind of an appearance is called a variegated appearance. I mean seeing areas of fat, areas of necrosis, areas of hemorrhage, areas of mucoid degeneration. All can be seen, hence the name variegated appearance. This specimen is a little worse when compared to this. So here again, I'm able to find the normal kidney, and this is called the perinephric fat. The perinephric fat is over here. The upper pole and the middle of the kidney are totally replaced by the tumor. The tumor again is circumscribed. I am not using the word capsulated. It is circumscribed and showing areas of necrosis. Look at the black color. Areas of hemorrhage. Look at the red color. And there are areas of yellowish color because there can be some amount of fat in it. There is also gray white area. All are present. This is particularly friable to my eyes. Also, I am finding a nodule that is appearing outside this, which we usually describe as satellite nodules. Satellite means it is surrounding it. So I find that kind of an appearance, a variegated tumors with satellite nodules, replacing the upper pole and the middle of the kidney. This is a microscopic picture of it, a very beautiful line diagram, which you people can draw in your records. I am finding clusters of cells. Look at this one, it is one cluster, or sometimes it is in sheets. They are large, round. So in some areas, I am finding that the cells are polygonal, round to polygonal cells with a clear cytoplasm. Why clear cytoplasm? Because of glycogen, because of fat, which are dissolved by the processing. And in the center, I find the nucleus. Somewhat vesicular, that means it can allow light to pass through. This is hyperchromatic and dark. So these are the tumor cells in S. And there are some fibrous septae which are separating them, containing blood vessels. This is another example of the same. In this, I am finding large sheets of the tumor cells. Look at the outer L-shaped lesion alone. I find that there are multiple nests and sheets are there, and this eosinophilic one are the fibrous septae. This is another variant of it, which is papillary, finger-like, and at the edges of the papillae, I'm finding the tumor cells. So these can be the various variants of it. It can be a clear cell, it can be granular, it can be brown or a chromophobe, or it can be papillary. I would like you people to kindly go back to your books as well as my classes on R.A.T.S. I would like you people to go through the entire renal cell carcinoma. It can be associated with various syndromes. Von Hippel-Lindau syndrome is one in which there can be a carcinoma and then there can be a benign counterparts elsewhere. What is the mode of spread? Look at this. So here also I am finding that the tumor is invading the renal vein. It is going into the inferior vena cava as I am seeing in this region. So it is invading the renal vein. It is ascending the inferior vena cava. Here also it is seen. So it can be going up to the right side of the heart, up to the right ventricle in a snake-like manner. Also, I find that there is a small bit of retrograde spread. Lower down, the tumor can spread into the ovarian vein in females and the spermatic vein in males. Also, the different zones, the gerotas, fascia, etc., can be invaded. This can be the gross appearance that you people can draw in your records and elsewhere. It is a bosselated appearance. When you measure also, you find that the upper pole is broad because of the tumor. The lower pole, it appears normal. And it has got a bosselated appearance. It appears smooth, but still it is undulating. And here is a cut surface and it is almost abutting on the adrenal. So it used to be called the hypernephroma because people thought it was originating from the adrenals. But now the cell of origin is found to be the tubular epithelial cells of the kidney. So it is a renal cell carcinoma or a proper name Gravit's tumor. These things have been described well. I would like you people to go through and do not get confused if you are asked such questions as Gravit's tumor or a hypernephroma. This is another tumor, the Wilms tumor. Whereas the renal cell carcinoma can be found in elderly people in the 5th and the 6th decades. This is found within 2 to 3 years of age. And usually it is the mother who makes the diagnosis because it appears as a flank mass. She is able to palpate it and then take the patient to the doctor. Also, there can be some complaints such as fever, hematuria, as well as hypertension, which can be seen in renal cell carcinoma also. So this is a specimen of the kidney, which is largely replaced by a tumor. Almost the entire upper pole, the middle have been replaced, and when it is cut, it is bulging above the cut surface. It is appearing more or less uniform, but it is fleshy in appearance, and again it can be bosselated. Look at the picture over here. You are finding a bosselated appearance of the tumor that is seen. A bosselated appearance, and this is the normal kidney. When the specimen is given, you people are supposed to write the measurements. Microscopically, you find, remember this word triphasic. Triphasic means there are 3 elements which we should remember. The main one will be the blastemal elements. Look at all these small dark blue cells. They are all immature cells, not very large, but they are dark and quite frightening, which are called the blastemal cells. 1. 2 will be the epithelial components. I am able to find some tubule-like structure over here, and this is the primitive tubule, not fully developed. Also, glomerular structures, which can be a primitive or an aborted glomeruli. These are the epithelial components. Blastemal and then the epithelial. The third one can be the mesenchymal elements. This is something like the smooth muscle that I'm seeing over here. You can get a smooth muscle, you can get a skeletal muscle, you can get a cartilage or even osseous component. So since 3 components are present, it is called a triphasic tumor also. So much so, rarely we can get even a rhabdomyosarcoma, a malignant tumor of the skeletal muscle from this. There are a lot of syndromes which I have dealt with in detail, both in your text as well as in my classes. VGR, for example, which can be the Wilms tumor, there can be aniridia or the absence of the iris, and there can be genital abnormalities which can be seen. So this is another one wherein there is a loss of the WT1. As a result of which you find that there are abnormal nephrogenic risks which are getting activated, and these lead to a tumor, probably the Wilms tumor over here. WT1 loss of function, and along with beta catenin activation, it can lead to the Wilms tumor. So that is the Wilms tumor as such. And the third one, as we had been mentioning, can be the third tumor is the carcinoma of the bladder. When I say bladder, it is the urinary bladder. The gallbladder will be small pouch-like, whereas the urinary bladder is large and bag-like. Dear students, there are only two bag-like structures in the human body for you. One is the stomach, the second one is the urinary bladder. In this case, I am finding multiple delicate finger-like projections in a tumor, rather a sea anemone-like picture. It is exactly how it will be appearing when they use a cystoscope to examine the tumor. It will be like the tentacles of those which are waddling in a sea of water. In this case, it is multicentric, delicate, grayish-white in color. This picture denotes the various stages of the transistor cell carcinoma. So, this is a carcinoma in situ, and here it is superficial, it is penetrating the mucosal region, and finally it goes on to traverse the entire thickness. This is an advanced stage of it, wherein I find that there are multiple tumors over here, and the entire bladder is massively thickened. Coming to the microscopy, it is called a transistor cell carcinoma, but arises from the transistor epithelium of the bladder. There are two types. One is papillary. Look at this one. Papillary means finger-like. So there are multiple finger-like projections over here, and this is a slender fibrovascular core, and I'm able to see some blood vessels. These are lined by multiple layers of these tumor cells. If you people can see the dark blue dots that indicate the nuclei. Look at the number of nuclei over here. So it is more than 10 layers. Less than 7 or 6 is supposed to be normal, but when it is more than 7 or 10, it indicates a transistor cell carcinoma. The other features you people can read up. There can be loss of polarity, pleomorphism, increased mitosis, etc. This is a picture again. Such a slide may be kept for you in the examination, wherein mainly by means of the finger-like projections we are able to make a diagnosis. This is another type of the bladder tumor in which I am able to see a flat tumor. There is a mucosa over here. There are no finger-like projections. It is infiltrating. Initially, it is confined to the superficial zone. Later on, it penetrates the entire thickness. So it is called an infiltrative type of transistor cell carcinoma. These things I would like you people to kindly remember. So definitely these are all university questions. They can be kept as specimens also for you people. Can be kept in the Viva OC as charts as well as slides. And then there can be some problem-based questions, etc. for you. So kindly go back and read. And these are the various sources of references. So I have summed up the entire thing. Hope you people do well.